Hello and welcome to this discussion on the growing coronavirus alert in the Northeast. Strong and decisive steps are being taken by the state governments in the region to ensure there is no spread of the COVID-19 to the area. While the Himalayan state of Sikkim has banned the entry of foreigners, Arunachal Pradesh too has suspended issuing protected area permit, and even the ILP, as per reports, does virtually blocking all outsiders from travelling into the frontier state. Meanwhile, in Assam, screening of passengers is now not only restricted to the Guwahati International Airport alone, but screening now is also done at the Guwahati railway station too. Meanwhile, the state health authorities have also screened and are monitoring over 400 people who may have come in close contact with the US tourist who tested positive for COVID-19 in Bhutan after travelling from Assam. While satisfactory measures seem to be in place to tackle any possible outbreak of COVID-19 in the region, rumour mongering has been another challenge, a growing challenge rather, for the authorities across states. The fear psychosis generated by rumours, especially in the social media, have led to shortage of hand sanitizers and masks in most pharmacies of the states across state capitals. Can the authorities tackle this double challenge? What should be the way forward, and is there any real need to rush for that elusive mask? That is also one question that we're asking, because almost every second person now in the region too seems to be wearing a mask when they are out. So these are some of the questions that we'll be looking answers to, and to take the discussion forward, I'll be joined by Komkar Dulom, Deputy Commissioner, Itanagar Capital Complex. In the studios, I have with me Dr. Smitakshi Medhi, MD Tuberculosis and Respiratory Diseases, Hayat Hospital. In course of the discussion, we'll also be joined over the phone by our Bomdila correspondent Prem Chetri and Sikkim correspondent Sujal Pradhan. If I can go straight to the DC Itanagar Capital Complex, have there been any suspected cases in the Itanagar Capital Complex so far, and are the necessary precautions in place? That's the first question, Mr. Dulom.
So far, we have not detected any case in capital region, and necessary steps we have taken is, first thing, we had one emergent meeting yesterday, and where we had called all the doctors, then all those pharmacists and chemists, plus the distributor of your mask and sanitizer. And then we called all our police and magistrates, and we had the meeting. And in the meeting, we had taken a decision that first of all, they will have to stop this panic situation.
Absolutely.
So we have told the pharmacist and this thing chemist, when people come to them for asking for this thing, they should tell them little do's and don'ts. So we have requested them not to create any panic situation. And then 2-3 more steps we have taken, that is related to making of isolation ward in TRIMS, Nagaland Hospital. And then we have written to RK Mission Hospital also. And TRIMS already they have worked out. They have got one isolation ward of 6 bed capacity, which can be upgraded to 35. That has been taken care of. And then we have also decided, in case need be, we'll do some screening even at the check gates like Gumto, Bandardua, and then your Holongi, and even necessary, if necessary, even at the helipad and railway station. But that is subject to, the advisory note that we will be receiving from the government. Otherwise, as such, even the PAP, that is protected area permit for the foreigners, has been temporarily suspended.
Yes, that brings me to my second question. The state government has already suspended issuing any protected area passes and possibly even the ILP, but are locals, the indigenous populace of Arunachal Pradesh who are coming from outside, maybe some local residents of Arunachal Pradesh who are, say, in Delhi or some other parts of the country, when they are coming back, to the state, of course, they do not need any PAP or ILP. When they are coming back, are they being screened properly before they get into the state? Is that step been taken?
Not, I mean, of that kind now, but I mean, we are watching the situation. If need, we will certainly do it. But as of now, there is nothing to panic about that. People know there was an advisory, I mean, from the state government. I think a few people have gone abroad from even Arunachal Pradesh also. Few of them are staying outside the state. They are not here. And I think 3 or 4 persons are there, and I mean the state government is tracking them, and obviously they will be put under observation. And if need be, if this kind of situation comes, we'll do thorough screening. And then, but as of now, we don't have that kind of situation here now, because we have seen the list given out by even the ministry also. Northeast, I don't think there are cases even in the Northeast. I think
not at all,
because we have
not
seen
so
the
far,
highest number
thankfully,
is from the Uttar Pradesh, then Delhi, and few other the states.
Yes. So basically,
having
no
said
real.
That, it's not that we should just relax.
Yeah.
We'll have to take all the precautions.
No room for complacency, even though there is
do's and don'ts.
Yeah.
I mean that public will have to adopt. I mean, to be on alert side.
Now, Dr. Medhi, what we've been getting reports from across the region, for instance, in Arunachal capital Itanagar, most of the pharmacies have already run out of hand sanitizers and masks. Same with Agartala, there's a growing rising demand, and pharmacies are running out of masks and hand sanitizers, and so is the condition in many other places in the region. The question is there a real need for every individual out there on the streets today to wear a mask? That's the first question. That is something even the authorities had been trying to clarify. What do you have to say about that?
See, actually, it has been told that each and every individual, it's not necessary to wear a mask for everyone. If we are healthy, we do not have any symptoms of flu, viral infection, then it is not necessary that we wear a mask and go outside. Only the people who are having symptoms of flu like common cold, fever, running nose, cough, then these kind of people, it is important that you wear a mask so that you do not spread the infection to others. And the other people who do not have any infection, any signs and symptoms of any viral infection, then it is not necessary that we wear a mask and go outside. And second thing, if we want to protect ourselves, it is also advisable that you can use your handkerchief, any tissue to cover yourself. Your dupatta in case of females can help you to use it as a mask, and in case of people living in villages, they can wear their gamusa as a protective equipment. So it is not necessary that you need to wear that surgical mask and roam about. And second thing is that the N95 mask which is used, that is advised to use only by the practitioners who are coming in direct contact with positive cases. So these people need to wear that N95 mask and other protective gears, and doctors who are dealing with patients having symptoms of respiratory disease like cough, fever, difficulty in breathing and so on. So they need to wear a simple face surgical mask. That is enough.
And those are posted at the railway station, the airports, who are actually screening passengers can also maybe use that.
Yes.
It could be useful for them, but need not necessarily for everybody out there on the streets. That's a very important, vital piece of information, especially when there is a mad rush for masks and hand sanitizers. We are also being joined by Roshan Rai, our Meghalaya Bureau Chief from Shillong. Roshan, there was this report, there was this this report doing rounds, especially in the social media and WhatsApp groups, that suspected coronavirus COVID-19 case has been admitted in NIGRIMS. Obviously, we have the confirmation it is not a case of COVID-19, but we also are getting reports that an FIR has been filed by one individual saying that his photo has been circulated as that of the suspected coronavirus patient. So, first of all, you know, is rumor mongering growing as far as coronavirus is concerned? Is that a concern for the district administration and the police?
Yes, considering the coronavirus scare, rumor mongering is at its peak, be it Meghalaya or anywhere, and of course Meghalaya is no exception. It's the same condition out here, and that is what we saw this morning. What is more shocking and important also is that the confidentiality of the patient was released. It was out in the social media, his name, everything. That raises a lot of questions to it. Nonetheless, we spoke to the doctors later during the day, and they said that they'll take proper measures out there. But then, yes, rumor mongering definitely at its peak, and especially with the patient's confidentiality out into the open, is something that really needs to be looked upon.
Roshan, following this incident, of course, we know that an FIR has been filed. Following this incident, will there also be an increased monitoring of the social media pages? And of course, it's very difficult to monitor WhatsApp groups, but nevertheless, is the district administration chalking out any strategy to keep a tab on the social media, especially so that there is no rumor mongering? Because mind you, around close to 40 people had come back, some from China, some from Russia, a month back. Of course, none of them showed any symptoms, and I'm sure their quarantine period is also over by now. So Meghalaya has no suspected cases of coronavirus whatsoever. But having seen as to what happened today, is the district administration chalking out strategies to have a better monitoring of the social media in the days to come?
Yes, definitely the district administration is keeping a close watch on all the social media platforms to see that rumor mongering doesn't really, gets there. And yes, they are also keeping, they are releasing advisories, and also they are appeal from the health department as well, asking people to keep away from rumor mongering. And if there's anything, if they have any health problems as well, they can always go and get it checked. Plus that, they can always get it, if there's reports as such, they can always report it to the authority and find out whether it's true or not.
Roshan, my last question to you is, states like Sikkim and Arunachal have already banned the entry of foreign nationals in the wake of the COVID-19 threat. Is Meghalaya mulling any such step, any information? Because we all know Shillong and its neighborhood outskirts, Cherrapunji, Sora, they are tourist destinations, and has a good inflow of both domestic and foreign tourists. Sikkim has gone ahead to restrict entry of foreigners. Any such plan in the offing as far as Meghalaya is concerned? Any inkling, any indication?
No, there's no such plans in the offing at this current point in time. Of course, various measures are being put in place, say for instance, the Umrah airport, proper checking is going on, and medical screening has also started out there. And like you mentioned earlier, many students who had come back from China or had a travel history of China were quarantined and released after the quarantine period. And also, like I mentioned, the government has been continuously giving out advisories to get to the nearest doctor if there's any symptoms or any such flu-like symptoms. And this is it at this moment. The government is saying that they are taking precautions, but when it comes to banning the entry, this is something which the government is not working on at this moment.
Roshan, thank you so much for all those updates. If I can come back to the studio, so to Dr. Mehdi. Dr. Mehdi, all this while the focus was on foreign nationals, foreign tourists on airports. Now that we have, we are counting 43 and counting confirmed cases in the country. and today already a screening of passengers has already started to incoming trains from outside the region in the Guwahati railway station. Now, do you think it's getting a bit more complex? Earlier it was simple, if anybody has had contact or has visited an area which has been affected, probably you need to take precaution. But today we have had cases in Delhi, in Noida, in Bangalore, Hyderabad, Jammu, Amritsar. So it's there. Even one case is a case, and it has to be taken seriously. So do you think that complicates things? And now, if anybody who has traveled outside the region probably and showing any symptoms, do they also need to go through all the proper tests? Is that the need of the hour?
See, each and every individual who has traveled outside, like I am saying within India, in the recent times, but if they are not showing any symptoms, I would say that you can wait and watch. And second is, if somebody is having symptoms of cough, fever, shortness of breath, difficulty in breathing, then of course you should need to go to the doctor and test yourself, because it is always better to be safe than sorry. And second is just maintain your basic hygiene measures. You wash your hands whenever you go to a public place. Most important thing is that if you touch something, obviously we are going to touch places, you are going to touch the door handles and doorknobs, the buttons in lifts. So you go and wash your hands, and if you have a sanitizer with you, well and good, you just wash your hands with the sanitizer, and don't touch your mouth, nose and eyes without washing your hands. That is very important, because this virus spreads through your nasal passages and through your entry through the mouth. So it is important that when we go and touch something outside, we should not touch our eyes, nose and mouth without washing our hands. That is very important. And second is maintain a distance from people who are suffering from flu-like symptoms. Just it has been advised to maintain a minimum of 1 meter distance, because that is how the virus may spread to me, because if somebody is coughing right in front of me, then I may get it. And also it is advisable to people who are having respiratory symptoms that you maintain your own basic hygiene. And also when you cough or sneeze in a public place, please use a tissue or your handkerchief. Tissue if you are using, just throw it. Handkerchief, just go and wash it in your house. And if you don't have an handkerchief and tissue with you, just use your bent elbow. That will also suffice.
All right, that's quite some piece of information. If I can go back to the DC Itanagar Capital Complex, apart from the real threat of coronavirus, it is also the fear psychosis that you mentioned earlier, fear psychosis among people that needs to be dealt with. What steps is the district administration taking, especially at a time when most pharmacies in Itanagar are running out of masks and hand sanitizers? And again, this may be happening due to panic buying, or even worse, maybe hoarding, you never know. And the doctor here said that there is no real need for everybody out there on the streets to have a mask. In fact, those with showing symptoms can wear one to stop the virus from being spread. What are the steps the district administration has been taking to ensure there is no panic and there is no panic buying, there is no shortage, because there is probably no real need of stocking masks and hand sanitizers?
It's only the panic situation has made them to rush for buying all these things. Otherwise,
Yes.
it is not required. Even we have discussed with the doctors. They are saying that a little precaution has to be taken, because like this, when you sneeze or when you cough, you'll have to use handkerchief and all those kind of things. And then you will have to wash your hand with soap as often as possible. And take care of yourself, having hot food, beverages and all sort of things. So little hygienic, I think this thing will take care of everything. But this panic buying is basically because of some news in social media also. So we
Yes.
have also in the meeting taken a decision, if there is some such elements who creates unnecessary panic and spreads wrong message in the social media, the district administration and police will take strict action against them also. So that is there, and we have requested the pharmacist and the chemist and the main person is the distributor, Mr. Bagang. He is the main distributor of all these items. So we have requested him that you will have to make available all these things and then patiently listen to the public when they come to them and tell them that there is no such kind of situation where the people should panic. And for your kind information, we had experienced the same situation last year when there was a panic buying of poll items when there was a burn in Assam and all like that. So therefore, through your medium also, I would like to appeal to the denizens of Itanagar capital region. They should not panic, and if they want any news to be confirmed, they should speak to us, to district administration and to the police as well.
Should contact the district administration. Well, I have over the phone from Bomdila Prem Chetri, our correspondent. Prem, we just had the Itanagar Capital Complex DC saying that if there's any shortage of anything and if there is any concern, the people of the area should contact the district administration. We are learning that masks and hand sanitizers are in short supply in Bomdila as well. Is this because of panic buying, Prem?
Yes. Here I would like to say that the people, there is a lack of awareness among the people, and it is just because of the panic that got spread all through the social media, and because of that there is a huge rush of the people. This morning I read to the pharmacists, and it is found that they are running short of the stocks of facial masks and hand sanitizers. Even these things are not available in the cosmetic shops also. Earlier, the cosmetic shops, they also used to have the bundles of sanitizers and facial masks. But even these things are running short in these places.
Yes.
Yeah,
go ahead.
People are not aware. Yes.
Okay. And do the health authorities in the area have the necessary equipment for screening of people if need be, Prem?
Yes, the health authority over here, we have in West Cummings, there are two police check gates, which are the entry points into the West Cummings district. So in these two police check gates, earlier there was no scientific or the proper screening kits were available, but it is on today, from today only, that the screening kits are available, and they are also doing the screening of the people, travelers who are getting into the West Cummings district.
All right, thank you.
At the same time, I would like to tell that the health department of the West Cummings are also in a plan to set up a quarantine where, if necessary, if any suspected person is found, then the person will be put in the quarantine for observation.
All right. Thank you, Prem Chetri from Bomdila, for all that information. Dr. Mehdi, what has happened is that there is so much fear. There is so much fear among the people. It's like we are treating, probably, are we treating coronavirus as something bigger, COVID-19 as something bigger than it really is? Probably, say, if it out of 100 people that it affects, probably only 2 or 3 don't survive. The rest make it. So it's just another virus, and we can fight it. But who are the best equipped to fight this virus? If I'm a perfectly healthy person, good sound lungs, and I'm doing well, maintain a healthy lifestyle, well, 9 out of 10 times I'll be able to make it, right? Is that not the case?
Yeah. Actually, the fear has spread because the virus initially, when it had come in a huge proportion. But if you see, the fatality rate is less. It has got a 2% case fatality rate, out of which only 2% people have died, and the rest have survived. In China also, if you see, till now, or around 1 lakh people have had infected with the disease, but only 3,800 something have died. So the case is, the disease has its more severity in people who have got a lesser immunity, like people who are suffering from chronic diseases like diabetes, any people having some immunosuppressive drugs from before, transplant patients, any people, elderly patients more than 65 years of age or 2 young children, they are at a higher risk because their immunity is lesser than that of a normal people. So, this category of people, they need to be a little more cautious, and for the rest of the population, if you do not have any comorbid conditions, you are well, you are doing fine, you are healthy, no need to panic, you just maintain your basic hand sanitizing methods, just remain away from people suffering from flu kind of symptoms, and you maintain your own hygiene. That will suffice.
All right. Well, Mr. Dulam, last question to you. Just digressing a bit from the entire medical part of it, we've been talking a lot about it. What kind of impact do you think suspension of the protected area pass and even the ILP have on trade and tourism industry in Arunachal Pradesh, especially Itanagar? How long do you think can the state afford to have a restriction in place for entry of outsiders? I am saying this because, for instance, the Himalayan state of Sikkim, the hotel industry, the tourism industry is really worried because there has been a decrease in the inflow of tourists. There is a ban on the entry of foreign tourists. Of course, we all do understand that the need of the hour is to stay safe, and hence the step taken by the state government is judicious. It's a judicious step, but how long can it continue? And you know, is it having, what kind of impact it is having on, especially on tourism?
There would be a little impact, of course, because overall, this will affect the whole travel scenario of the country also.
Yes.
But I think the issuance and this thing, suspension of protected area permit is the, it's in the domain of the state government. So the state government will certainly take a call on that. But by and large, it's only for a short period. The moment the situation improves, I think this will be done away. It's just a temporary measure.
Definitely. We are running out of time. Last words from you, Dr. Mehdi. Your piece of advice for everyone in the region as to why they should not be too worried and what are the basic precautions that they should take very quickly.
Yeah. If you are healthy, you are not having any symptoms, no need to panic and go on searching for a mask. It is not that important. If you are going in some public gathering where there is a lot of people may gather in that place, then it is better that you maintain some precautionary measures, like you can wear a mask, and if you don't have a mask, you use your handkerchief or any kind of clothing as a protection, as a barrier. And secondly, if you are going to public places, just remember to wash your hands before touching your mouth, eyes and nose, and go home and wash your clothes and wash your hands.
Basically maintain a very decent basic hygiene.
Yeah.
That's the basic mantra. Well, the state governments, the health authorities in Northeast are doing a good job, we must say. They are on the job as far as the preventive measures are concerned, and we only hope that the COVID-19 does not spread to the region. Thank you so much, Dr. Mehdi. Thank you, Kulkar Dulam, for joining us from Itanagar. That's a wrap of this show.